What if the numbness in your feet, the burning in your hands, or that weird pins and needles feeling that shows up at night isn't just getting older or bad circulation? What if your nerves are actually being slowly poisoned by things you're exposed to every single day? Things in your drinks, your food, your air, even some medications? Neuropathy doesn't always start with a disease. Sometimes it starts with hidden toxins quietly damaging your nerves little by little. In this video, I'm breaking down the most dangerous nerve-harming toxins and how to protect yourself before the damage becomes permanent. Most people hear the word neuropathy and immediately think of diabetes or just getting older. But what often flies completely under the radar is how many everyday toxins can slowly damage your nerves without you realizing it. Toxic exposure doesn't usually come with flashing warning signs. It tends to build quietly over months or years, creating subtle changes in how your nerves function until those changes finally show up as numbness, tingling, burning pain, or weakness that seems to come out of nowhere. Your peripheral nerves are incredibly sensitive structures. They're responsible for carrying signals from your brain and spinal cord to the rest of your body and back again. That includes sensations like touch, temperature, and pain, as well as instructions that control your muscles, and even some automatic functions like digestion. Because these nerves are long and delicate, especially the ones that travel all the way down to your feet and hands, they are particularly vulnerable to damage from toxic substances circulating in your bloodstream. The tricky part is that many of these toxins are things people encounter in normal daily life. We're not just talking about rare industrial accidents or extreme poisonings. Regular alcohol use, long-term exposure to polluted air, chemicals in certain workplaces, residues from pesticides on food, cigarette smoke, and even some medications can all contribute to a growing toxic burden in the body. Over time, these substances can interfere with the way nerve cells produce energy, disrupt the protective coating around nerves, or trigger inflammation and oxidative stress that gradually injures nerve tissue. Because this damage happens slowly, the body often adapts at first. You might notice your feet feel a little less sensitive to temperature, or you occasionally get pins and needles that go away after a few minutes. These early signals are easy to ignore or blame on something harmless like sitting too long or wearing tight shoes. Meanwhile, the underlying exposure may still be happening day after day, allowing more nerve fibers to become impaired. Another reason toxic neuropathy is overlooked is that symptoms usually start in the longest nerves first, which means the toes and feet are often affected before anything else. People may not connect foot numbness or burning at night with something like alcohol use, chemical exposure at work, or long-term smoking. By the time symptoms move into the hands or start affecting balance and strength, significant nerve injury may already be present. What makes toxic causes especially important to understand is that in some cases they are preventable or at least reducible. Unlike genetic conditions or unavoidable aging, environmental and lifestyle exposures can sometimes be changed once they're recognized. The earlier someone realizes that their nerves may be under attack from everyday toxins, the sooner they can begin to lower that exposure and give their nervous system a better chance to stabilize or partially recover before the damage continues to spread further through the longest and most vulnerable nerve pathways in the body, where signals struggle more and more to travel clearly and consistently through tissues that are no longer functioning the way they were designed. Alcohol is one of the most overlooked yet powerful toxins when it comes to nerve damage, largely because it's so socially accepted and deeply woven into everyday life. Many people associate alcohol-related health problems with the liver, but far fewer realize how directly it can affect the nervous system. Over time, especially with heavy or frequent drinking, alcohol can quietly injure the peripheral nerves, leading to a condition known as alcoholic neuropathy that can seriously impact quality of life. What makes alcohol particularly harmful to nerves is that it doesn't just work in one way. It delivers a double hit. First, alcohol itself is toxic to nerve tissue. Nerve cells rely on a steady, balanced internal environment to send electrical signals properly. Alcohol and its byproducts can disrupt that balance, interfering with the normal function of nerve cell membranes and damaging the structures inside the cells that are responsible for producing energy and transporting essential materials along the length of the nerve. Since some peripheral nerves stretch from the spine all the way down to the toes, any disruption in this internal transport system can have major consequences. The second part of the damage comes from nutritional deficiencies that often develop with long-term alcohol use. Alcohol interferes with the absorption, storage, and use of several key vitamins, especially B vitamins like thiamine, B1, pyridoxine, B6, and cobalamin, B12. These vitamins are critical for maintaining the protective myelin sheath around nerves and for supporting the chemical reactions that allow nerves to generate and transmit signals. When levels run low, nerves become more vulnerable to injury and less able to repair themselves. This means alcohol is not only attacking the nerves directly, but also removing the tools the body needs to defend and heal them. Symptoms of alcohol-related neuropathy usually develop gradually. It often starts in the feet with numbness, tingling, or a burning sensation that may be worse at night. As damage progresses, the strange sensations can move up the legs and eventually affect the hands. Some people experience sharp, stabbing pains, while others notice a loss of sensation that makes it hard to feel the ground when walking. Weakness can develop as motor nerves are affected, leading to muscle wasting or difficulty with balance and coordination. Because the onset is slow, many people don't connect these changes to their drinking habits until the symptoms become hard to ignore. The frustrating part is that nerve damage from alcohol doesn't always fully reverse, especially if drinking continues for years. However, reducing or stopping alcohol intake can prevent further damage and, in some cases, allow partial recovery over time. Supporting the body with proper nutrition, especially replenishing deficient B vitamins under medical guidance, can also make a meaningful difference. The key is recognizing that alcohol is not harmless when it comes to nerve health and understanding that even before liver problems appear, the nervous system may already be struggling under the weight of ongoing toxic exposure that slowly weakens its ability to send clear, accurate signals between the brain, spinal cord, and the rest of the body, where sensation and movement depend on healthy nerve communication functioning smoothly without constant chemical interference from repeated alcohol exposure. Over months and years, when people think about nerve damage, they rarely picture the chemicals in their environment or workplace as part of the problem. Yet these exposures can play a major role in the development of neuropathy. Many industrial and agricultural chemicals are designed specifically to disrupt biological systems, and unfortunately, human nerves can become unintended targets when exposure happens repeatedly or over long periods of time. The danger is that these toxins often enter the body in small amounts through the skin, lungs, or contaminated food and water, quietly building up their effects without causing immediate dramatic symptoms. Pesticides are one of the biggest concerns. Many of them work by attacking the nervous systems of insects, interfering with the enzymes and signaling processes that allow nerve cells to communicate. While humans are not insects, our nervous systems rely on similar chemical messengers and electrical signals. Chronic exposure to certain pesticides, especially in agricultural workers, gardeners, or people living near heavily sprayed areas, has been linked to symptoms like tingling, numbness, muscle weakness, and coordination problems. Even low-level exposure over time may create ongoing stress on nerve cells, making them more vulnerable to damage. Industrial solvents are another group of chemicals strongly associated with nerve injury. These are found in products like paints, glues, degreasers, cleaning agents, and fuels. Workers in factories, construction, auto repair, printing, and manufacturing may be exposed through inhalation of fumes or direct skin contact. Some solvents, such as N-hexane, are known to damage the long nerve fibers responsible for sensation and movement in the hands and feet. Symptoms often begin subtly, with a feeling of pins and needles or mild numbness, then progress to more noticeable weakness and difficulty with fine motor tasks as exposure continues. Heavy metals in the environment also pose a significant risk. Lead, mercury, and arsenic can be present in certain workplaces, contaminated soil, old paint, industrial waste, or polluted water sources. These metals can accumulate in the body and interfere with essential cellular processes and nerves, including energy production and signal transmission. Over time, this can lead to a painful or numb neuropathy that may be accompanied by other neurological or systemic symptoms depending on the level and duration of exposure. One of the challenges with environmentally linked neuropathy is that the connection between exposure and symptoms is not always obvious. People may not realize that the chemicals they work with daily or the environment they live in could be slowly affecting their nervous system. Protective measures like proper ventilation, gloves, masks, and safe handling procedures are often underestimated or inconsistently used, increasing the risk of long-term harm. Reducing exposure can make a real difference. Using protective equipment at work, following safety guidelines carefully, washing hands and clothing after handling chemicals, and minimizing unnecessary pesticide use at home can all help lower the toxic load on the body. Being aware that these substances can affect nerve health is the first step toward prevention, especially for those in high-risk occupations where repeated contact with nerve-damaging chemicals may gradually impair the body's ability to maintain healthy sensation, strength, and coordination over time without any single moment of obvious poisoning or acute illness. To clearly mark the beginning of the damage when it comes to nerve damage, most people never suspect that something meant to help their health could end up harming their nerves. But certain medications, and even high doses of specific vitamins, can do exactly that. Drug-induced neuropathy is a real and well-documented issue. And while these cases are not the most common cause of nerve problems, they are important because they often go unrecognized at first. People may blame aging, circulation, or unrelated conditions, while the true trigger is sitting right there in the medicine cabinet. Some of the most well-known examples come from chemotherapy drugs used to treat cancer. These medications are powerful because they target rapidly dividing cells, but in the process, they can also affect healthy nerve cells. Drugs such as platinum-based agents, taxanes, and vinca alkaloids can interfere with the internal transport systems inside nerves that move nutrients and essential materials up and down the long nerve fibers. When this transport breaks down, the nerve can't maintain itself properly, leading to numbness, tingling, burning pain, or sensitivity to touch that often starts in the hands and feet. For many patients, this is an unfortunate trade-off in life-saving treatment, but the nerve symptoms can linger long after chemotherapy ends. Outside of cancer treatment, several other prescription medications have been linked to peripheral neuropathy in certain individuals. Some antibiotics, including metronidazole, nitrofurantoin, and certain fluoroquinolones, have been associated with nerve-related side effects, especially with prolonged use or in people with other risk factors. Medications used for heart rhythm problems, such as amiodarone, and drugs used to treat tuberculosis, like isoniazid, can also contribute to nerve damage. In the case of isoniazid, the drug can lower levels of vitamin B6, which is essential for nerve function, and without supplementation, this deficiency can lead to neuropathy. What surprises many people is that vitamins themselves are not automatically harmless just because they're sold over the counter. Vitamin B6 in particular is a double-edged sword. In normal amounts, it's vital for healthy nerves, but in high doses over time, it can actually become toxic to sensory nerves. People sometimes take large amounts of B6 for energy, mood, or general wellness, not realizing that chronic high intake can cause numbness, tingling, and balance issues. Because it's a vitamin, they may not even mention it to their healthcare provider, which can delay identifying the true cause of their symptoms. The key issue with medication or supplement-related neuropathy is awareness. Symptoms often begin gradually and may be subtle at first, making it easy to miss the connection. If new nerve symptoms appear after starting a medication or changing supplement habits, it's important to speak up. In many cases, adjusting the dose, switching drugs, or stopping an unnecessary supplement can prevent further damage and sometimes allow improvement over time, especially if the problem is caught before nerve injury becomes severe and more difficult for the body to repair through its limited natural healing capacity. Once the toxic exposure continues unchecked for too long, one of the most empowering things about understanding toxic neuropathy is realizing that your daily choice and awareness can actually make a meaningful difference in protecting your nerves. While not every cause of nerve damage can be reversed, reducing exposure to harmful substances and responding early to warning signs can slow progression and, in some cases, allow nerves to partially recover. The nervous system has some ability to heal, but it needs the right environment and enough time, which makes early action incredibly important. The first step is paying attention to what your body is telling you. Symptoms like persistent tingling, numbness, burning sensations, unusual sensitivity to touch, muscle weakness, or problems with balance are not just minor annoyances to brush off. These can be early signals that your peripheral nerves are under stress. Catching these signs early and seeking medical advice can help identify possible toxic exposures, nutritional deficiencies, medication side effects, or other contributing factors before the damage becomes more advanced and harder to manage. Reducing alcohol intake is one of the most impactful lifestyle changes for nerve health. Since alcohol can directly injure nerves and interfere with essential nutrients, cutting back or eliminating it can remove a major source of ongoing damage. For people who already have neuropathy symptoms, this step alone may help prevent further worsening and give the body a better chance to stabilize. Being cautious with supplements is another key piece. More is not always better, especially with vitamins like B6 that can be harmful in high doses. Taking only recommended amounts and discussing supplements with a healthcare professional can help prevent accidental toxicity. The same goes for medications. If new nerve symptoms develop after starting a drug, bringing it up promptly may allow for adjustments that reduce risk. Environmental awareness also matters. Using protective equipment when working with chemicals, ensuring good ventilation, and following workplace safety guidelines can limit exposure to solvents, pesticides, and heavy metals. At home, simple habits like washing fruits and vegetables, minimizing unnecessary pesticide use, and keeping living spaces free from mold and excessive pollutants can help lower the body's overall toxic burden. Smoking cessation is another powerful protective step. Smoking damages blood vessels and reduces circulation, which can deprive nerves of oxygen and nutrients. Healthier blood flow supports nerve survival and repair, making quitting one of the best things you can do for your nervous system. All of these changes may seem small on their own, but together they create an environment where your nerves have a better chance to function well and resist further injury. Awareness turns neuropathy from something that feels random and unavoidable into a condition where you have some degree of influence, especially when you act early, stay informed, and work with healthcare professionals to reduce ongoing toxic stress on a nervous system that depends every single day on clean signals, good nutrition, healthy circulation, and a lower load of harmful exposures that would otherwise continue to wear it down over time.